So I grew up mostly in small town Missouri, in Lebanon, Missouri, kind of by like the Ozarks. I ended up moving around kind of a lot as I grew up and spent some time in Nebraska and Oregon. But then my family ended up back in Joplin, Missouri. I went to undergrad at Brigham Young University in Utah, where I met my wife, who was raised here in the St. Louis region. Went to medical school in Kansas City, did my training in Columbus, Ohio, and then we were blessed to find an opportunity here in this area so we could be close to family and get established here. It was really a surprise to me. My dad was actually an administrator, a hospital administrator growing up. So my inclination growing up was that I didn't want anything to do with medicine really. I thought business would be more something that I'd be interested in. And in undergrad I had a class, I had business classes, and I was learning some principles of business, and I had a job I really didn't like. I was tech support for a security company, and I had angry customers calling me, and they were really frustrated with how the business handled them, and that didn't make me feel good. And then I was learning principles that kind of mirrored what I saw in my job, and I realized I didn't want to be in that kind of line of work where I'd be trying to make money off of potentially making people upset or not helping them as much as I could be. So that kind of changed my course to what can I do where I'll be happy with what I'm doing every day and feel like what I'm doing is helping the people around me. So that's when I kind of first thought about medicine. I think the most important thing is helping the patient to walk away from our conversations and our interactions without any regrets about the conversation. Whether that's, man, I wish I would have asked this question, or I wish the doctor would have given me a chance to speak. I feel like it's those stress-filled situations, it's easy to walk away from a conversation and have a lot of doubts or a lot of concerns. I really just hope that I can be someone that they can feel comfortable with, talking about things that are uncomfortable to talk about, talking about problems that they may be self-conscious about. I hope that they can feel that I really just want to be there to help them, whether that's offering a surgery or pivoting towards something that may be the best solution for them. My life right now really, outside of surgery and outside of my job, is focused on my family. So I've got twins that are 8 and a 5-year-old and a 2-year-old, so our house is busy all the time. And whether that is sports, watching sports and spectating my kids and the activities they're doing, or going to a dance recital, or just hanging out in the backyard with my kids, that's kind of what I do most of the time. I have in the past liked to golf, and I think that's something I want to get back in my life at some point. It'll probably be when my kids golf that I'll golf with them.